All right, let's dive in. Today we're looking at how experts are literally remapping a huge, really complex territory of lung diseases. Imagine you're trying to navigate with a super old, confusing map. This is like getting a brand new, crystal clear GPS update. So here's the big question, right? How do doctors even begin to navigate a family of over 200 different rare lung diseases? I mean, think about that. How do you find the right path when the landscape is just so massive and complicated? Okay, so the conditions we're talking about all fall under this big umbrella term, interstitial pneumonia. What does that actually mean? Well, just think of it this way. These are diseases that damage the lung's delicate internal scaffolding. You know, the supportive tissue and the tiny little air sacs that do all the hard work of getting oxygen into your body.
You know, to make sense of all this complexity, experts have to create classification systems. It's the only way to bring some order to the chaos. And today, we're getting a look at the latest major update. This is a big deal. It's a landmark statement coming from the European Respiratory Society and the American Thoracic Society, and it's slated for the 2025 European Respiratory Journal.
So before we can really appreciate just how big a deal this new map is, we have to talk about the old one. We've got to understand its limitations, especially its laser focus on this one little word, idiopathic. And here's the problem with that old map from 2013. It was almost entirely focused on what they called idiopathic cases, which is just a fancy way of saying cases where the cause was unknown. This created a massive blind spot, right? The new 2025 framework completely changes that. It blows the doors open to include all cases, whether we know the cause or not. It's finally one single, unified system for everyone. You can really see the evolution here. Back in 2002, the system was pretty much all about the most common type, IPF. Then, in 2013, they widened the view a little bit. But honestly, this 2025 version, it's not a step, it's a massive leap. It finally brings in all those known causes and even adds totally new categories and a whole new structure. It's a game changer.
Okay, now let's get into the nitty-gritty, the new blueprint itself. And get this, a committee of 32 global experts, plus 2 patient representatives, which is so important. They all came together to build this thing. And what they came up with has 4 major upgrades.
So here's the roadmap for what we're about to cover. We've got these 4 big advances. First, moving past that idiopathic label. Second, some new terms and categories. Third, a whole new way of structuring the diseases. And finally, a new focus on something called diagnostic confidence. Let's break them down. All right, let's tackle that second big change, language. You know, in medicine, the words you use matter a lot. Precision is everything. So the committee brought in some new terms that do a much better job of describing what's really going on inside the lungs. And a perfect example of this is a new term called BEEP, or Bronchiolocentric Interstitial Pneumonia. It's a bit of a mouthful, I know, but it's a brand new, major category that finally gives a name to a specific pattern of injury, one that starts around the small airways. Clinicians have been seeing this pattern for years across different diseases, but they never had one single unified name for it. Now they do. They also made a really important correction. Something that used to be called disquamative interstitial pneumonia, or DIP, well, that's now called Alveolar Macrophage Pneumonia, or AMP. So why the change? Turns out, the old name was just wrong. It was based on an old misunderstanding of what was actually happening to the cells under the microscope. This is literally science correcting itself as it learns more. It's pretty cool. Okay, change number 3 is a big one. It's all about structure. The new system creates a fundamental split right at the top. It asks a simple question first. Where's the main problem? Is it in the lung scaffolding, the interstitium, or is it that the air sacs are filling up with stuff they shouldn't be? This one change makes the whole diagnostic process way more logical. And to make this real, just take a look at this CT scan. This is a classic example of what they call an interstitial pattern, specifically one called UIP. See that web-like scarring there? Radiologists call that honeycombing, and it's a huge visual clue. It's exactly the kind of thing they look for to pinpoint the specific type of damage. And that brings us to the 4th and final upgrade, a new focus on confidence. It sounds simple, but it's a big deal. The new framework actually encourages doctors to say not just what they think is going on, but how sure they are about it. This is huge for standardizing communication and helping guide treatment, especially in those really tricky cases where the answer isn't 100% clear.
Okay, so a new map, new terms, that's all great for the experts, but you're probably asking, why does any of this actually matter to the rest of us? Well, let's talk about the real-world impact, because it's massive.
I mean, for patients and their families, this is everything. A more precise map means you get a more accurate diagnosis, and that leads directly to better, more tailored treatment plans. And maybe just as important, it means clearer communication. It gets rid of so much of that confusing gray area and helps people understand exactly what's going on with their health.
And what about for the doctors on the front lines? Well, this gives them a common language. For the first time, a doctor in Tokyo and a doctor in Toronto can use the exact same terms to describe the exact same thing. That means better accuracy and a much clearer playbook for how to handle the toughest cases.
And for the researchers trying to find new treatments, this is a total launchpad. Think about it. When everyone is classifying diseases the same way, you can design much better, more effective clinical trials. Global collaboration becomes a breeze. It creates the solid foundation that all future discoveries are going to be built on.
But here's the thing. This new classification, it's not the end of the story, not even close. It's really the beginning of the next chapter. It's a map that shows us where we are right now, but it also points to all the exciting new places we have yet to explore.
Because having a clearer view of the landscape isn't the finish line, it's the starting line. It lets scientists start asking even better, more sophisticated questions. So yeah, the map has been redrawn, but what mysteries are still out there waiting to be discovered? And the committee that wrote this new guide even laid out what the next big quests are. They're asking things like, what's the real role of genetic testing? Can we train AI to read these scans and biopsies even better than a human can? And what about finding tiny molecular clues in a blood test that can tell us exactly which treatment is going to work for which person? That's the next frontier, and that's where this journey is headed. Thanks for joining me.